Hi guys, we're Group 27 for Respiratory, and today we're going to talk to you about
cystic fibrosis.
NSQHS Standard 6 Clinical Handover requires all health service organisations to implement effective handover tools. The aim of this standard is to ensure there is timely, relevant and structural clinical handover that supports safe patient care. Clinical handovers can vary in a number of ways. They can occur at shift change, when the patients are being transferred within and between hospitals, during patient admission, referral or discharge. This can include face-to-face, by telephone or aided by electronic handover tools. Handover can be conducted at the patient's bedside or in a common staff area for shift change. The use of a standard process for clinical handover has been shown to improve the safety of patient care because critical information is more likely to be transferred and acted upon. The information that is transferred between healthcare providers should include all relevant data, be accurate, unambiguous, and occur in a timely manner. For today's handover, we will be doing a face-to-face at the patient's bedside.
Okay, so on bed 2 we have Matt Walker, a 20-year-old Caucasian male. Matt has had a persistent cough with excessive sputum production for the past week. He presented to ED at 0800 hours with chest pain. He has symptoms of coughing, shortness of breath, increased work of breathing and fever. Matt was transferred at 1300 hours to the acute inpatient ward for monitoring, management and recovery. Alright, so on admission, Matt was alert, he had difficulty talking in sentences, and he had shortness of breath. He complained about chest pain during inspiration and expiration and throat pain from excessive coughing. He has a productive cough which has increased dark green sputum production. His vitals on admission were his respiratory rate 32, his heart rate 124, his blood pressure 105/70 and his temperature 38.5 and oxygen saturation at 89% in room air. Alright, so we've auscultated his chest and we found that he has crackling in the lower base of both lungs and he wheezes upon inspiration. Matt was diagnosed with cystic fibrosis when he was 4 months old via a false negative heel prick test. He has a past history of recurrent pneumonia. He has nil surgical history, nil family history and no allergies. From the X-ray results, the doctor has discovered that he has a lower respiratory tract infection. Matt needs another set of OBS, including chest auscultation, and he's due for his medication.
So today I'm talking about the pathophysiology of cystic fibrosis. So CF is caused by a faulty recessive gene on the long arm of chromosome 7 that codes for the cystic fibrosis transmembrane conductance regulator protein. So this protein is a salt transport membrane. Defects in this gene result in chloride transport abnormalities, causing a decreased secretion of chloride and an increased reabsorption of sodium and water, affecting the mucosal surfaces of epithelial cells. Although there are more than 1,600 possible defects to the CFTR gene, over 2/3 of people with CF have the same delta F508 mutation, which causes deletion of 3 nucleotides on the gene. So in both Australia and New Zealand, all babies are screened for CF shortly after they're born. In Australia, approximately 80 to 90 babies are born with CF a year, which is about 1 in 2,800 births, and 1 in 25 people can become carriers of the CF gene. There are approximately around 3,000 people in Australia with CF at the moment. Common respiratory clinical manifestations include dyspnea, tachypnea, cough, wheezing, mucoid or pleuropneumonia of sputum, and nasal obstruction. So trauma from coughing paroxysms may cause hematosis, a pneumothorax, or pleuric chest pains. As the disease progresses, signs of chronic hypoxia become visible in the form of digital clubbing. The chloride transport defects from the CFTR gene begin to affect globular cell formation. Sodium ions and water are reabsorbed and this causes viscous mucus production. Additionally, the mucociliary dysfunction encourages bacterial colonization, infection, and initiation of the inflammatory response. Endobronchial and peribronchial spaces are affected by an intense neutrophilic response and a cycle of inflammation and infection that continues throughout life. Symptoms of CF can cause irreversible dilation of the airways and alveolar collapsion, and this follows the chronic disease process throughout the lifetime. So CF can cause dysfunction in multiple systems of the body, including the lungs, the pancreas, the intestines and the liver. And other systems can be affected as well with very different effects. CF patients are more susceptible to respiratory lung infections. This can be caused by a number of microorganisms such as E. coli, Staphylococcus and Pseudomonas. Patients with CF are especially susceptible to pneumonial infections because the abnormal mucus and reduced water content in the airways promotes this potentially fatal bacteria growth. CF was once considered a childhood disease, but with improvements in diagnosis and treatment, many people are living well beyond that. Cystic fibrosis is a multifaceted disease affecting not only the pulmonary but the gastrointestinal and endocrine systems.
Interventions to improve lung health include bronchodilators, mucolytics, antibiotics, and airway clearance physiotherapy. The first medication is a mucolytic. Its generic name is Donase alpha and its brand name is Pulmozyme. It is to be taken 2.5 milligrams or 1 ampule of 2.5 mils by the nebulizer daily. Mucolytics are inhaled medications that help thin the mucus in the airway so you can cough it out more easily. Improves pulmonary function and decreases the frequency of moderate to severe respiratory infections in people with cystic fibrosis. It hydrolyzes the DNA in the sputum of individuals with CF, causing decreased viscosity and elasticity of pulmonary secretions. It should not be taken if allergic to Donase alpha, calcium chloride, sodium chloride, also known as salt, or hypersensitive to drugs or products derived from Chinese hamster ovary cells. Side effects can include increased coughs, sore throat, chest tightness, voice alteration, laryngitis, pharyngitis, rash, fever, and dizziness. Some safety considerations: it's taken through a nebulizer, so don't mix with other drugs in the nebulizer. This could lead to a reaction that may inactivate the Donase alpha. Drug is used in conjunction with other standard therapies for CF. Don't exceed the recommended dose as it can increase the risk of side effects. Work in conjunction with proper chest physiotherapy helps the sputum to be cleared more easily. It should be taken before physiotherapy session or activities. Do not take it in the evening before bed. The second medication is a bronchodilator whose generic name is salbutamol and its brand name is Ventolin. Bronchodilators relax the muscles in the airway of the lungs. This dilates the airways to make it easier to breathe. When used to treat cystic fibrosis, the medication is given through a nebulizer or with an inhaler. This relaxes the bronchial and uterine smooth muscles by acting on beta-2 adrenergic receptors. His dose for the Ventolin nebulizer is 5 milligrams or 2.5 mils twice a day through the nebulizer, and for the Ventolin puffer, it's 2 puffs PRN. It's contraindicated in individuals who are hypersensitive to salbutamol or its components. Side effects can include anxiety, muscle tremors, shakes, increased heart rate, headache, dizziness, nausea, vomiting, diarrhea, palpitations, upper respiratory tract infections, bronchitis, increased sputum, dry mouth, and hyperkalemia from high doses. Some safety considerations include, if you're using a face mask for the nebulizer, take care to avoid leakage around the mask. It is used before administering other medications such as mucolytics, antibiotics, and other treatments like airway clearance techniques. The third medication is a fluoroquinolone antibiotic. Its generic name is ciprofloxacin and its brand name is Cipro. This is to be administered twice a day orally, 750 milligrams. Cipro is used for respiratory infections caused by E. coli and Pseudomonas. It inhibits bacterial DNA synthesis by blocking DNA gyrase. It decreases the amount of bacteria in the lungs. So contraindicated in individuals sensitive to fluoroquinolone antibiotics. Ciprofloxacin can interact with certain medications if they are taken at the same time. Examples are calcium, iron, or zinc-containing products. Avoid taking ciprofloxacin at the same time as these products. Take ciprofloxacin 2 hours before or 6 hours after these products. Side effects can include headache, restlessness, tremors, dizziness, nausea, vomiting, diarrhea, oral thrush, hypersensitivity reactions, insomnia, erythema, pruritus, rash, pseudomembranous colitis, fatigue, drowsiness, seizures, and elevated liver enzyme levels. Some safety considerations: unnecessary use or overuse of the antibiotic can lead to its decreased effectiveness. Cipro can cause your skin to become more sensitive to sunlight. Limit the amount of time you spend in the sun until you know how this drug affects you. When you're in the sun, keep your body covered in clothing and use sunblock preparations with zinc oxide on exposed skin. Drink plenty of fluids. Avoid caffeine and alcohol. You should take Cipro either 1 hour before or 2 hours after food or on an empty stomach. So the fourth medication is a corticosteroid. Its generic name is prednisone and its brand name is prednisone. This is to be taken 20 milligrams twice orally and daily. Prednisone works by decreasing inflammation in airways and lungs. In CF, corticosteroids may be used to treat lung inflammation and mucus plugging. They're used for various periods of time in individuals who have significant shortness of breath and wheezing. It works by entering inflammatory cells and blocking the inflammatory reaction. It is only able to prevent or reduce symptoms. It does not cure CF. It contraindicates with systemic fungal infections, so oral thrush. Side effects include insomnia, hypertension, edema, nausea, vomiting, increased appetite, headache, acne, delayed wound healing, susceptibility to infections, moon face, buffalo hump, central obesity, arrhythmias. After abrupt withdrawal of the drug, it can have rebound inflammation, fever, dizziness, depression, fainting, weakness, hypotension. After prolonged use, sudden withdrawal may be fatal. Safety considerations include prednisone is prescribed to people with CF for short-term treatment. Long-term therapy has the potential for serious adverse effects like the decreased ability to fight lung infections such as Pseudomonas. Prednisone is best taken with or immediately after food. Because this medication may cause stomach upset, it is best taken with food or milk. Alcoholic beverages may increase stomach burning or upset. You should monitor the person's blood pressure and sleep pattern, weigh the person daily and report any sudden weight changes, and don't discontinue the drug abruptly. In association with NSQHS Standard 3, Preventing and Controlling Healthcare-Related Infections, conducting regular hand hygiene before and after patient procedures will assist in reducing the spread of infection. The World Health Organization poster incorporates the 5 moments of hand hygiene, which includes before touching the patient, before aseptic techniques, after body fluid exposure, after touching the patient, and after touching the patient's surroundings. Medications are the most common treatment used in healthcare. Because they are so commonly used, medications are associated with a higher incidence of errors and adverse events than other healthcare interventions. Many of these events are costly and potentially avoidable. Before administering medication, it is important to follow the drug rights in order to dispense medicine safely. These include the right drug, the right reason, the right route, the right patient, the right dose, the right time, the right documentation, and the right to refuse.
Due to the gene defect, patients with cystic fibrosis have thick, sticky mucus that remain lodged in the airways. This creates an environment that bacteria thrives in, causing infections in the respiratory tract. These secretions can also block the passage of air, preventing the patient from breathing as efficient. The nurse will need to encourage the patient to cough up the mucus to preserve lung function. The nurse can administer mucolytics, which is a medication that thins out the mucus, enabling it to become more susceptible to chest physiotherapy and excretion by coughing. A nurse can cup their hands and pat the back of the patient around chest height. This is known as chest therapy. The vibrations caused by this impact knocks the mucus off the cilia. As it is no longer stuck to the wall of the bronchioles, it can be manipulated by a cough. Ensure Matt has kidney dishes, cups, or tissues within arm's reach that he can cleanly dispose of his coughed up sputum. The mucus will be prone to bacterial life, so doing so will reduce the spread of infection within the ward. Sitting the patient up will also allow for easier work of breathing, as the patient is now able to fully expand their chest. This will also allow the patient to bring up sputum easier in this position. Monitoring vital signs is an important role in the nursing care as they reflect an individual's current health status. Vital signs include monitoring a person's temperature, pulse, blood pressure, and oxygen saturation and respiratory rate. These indicate whether the body's homeostatic mechanisms are remaining within normal limits. The body will not be able to thrive long if the indicators fall outside these limits. It's important for the nurse to pay especially close attention to the respiratory patterns as he is an increased risk from his condition. Cystic fibrosis and lower respiratory tract infections will impact Matt's ability to be able to respire at optimal levels. This is due to the increase of sputum production, inflammation, and sticky mucosa in his lungs and respiratory tract. On admission, Matt's oxygen saturations were 89% and his respiratory rate was 32. At this point, Matt's respiratory condition is well out of normal range and requires immediate interventions to sustain life. Oxygen therapy is the administration of concentrated oxygen into the body and is used for when a patient's oxygen sats drop below well normal limits. When administering oxygen, follow these guidelines. If sats are below 90%, a Hudson's face mask at 6 to 10 litres per minute is required. The oxygen flow can be delivered at a higher rate as the mask utilises both nose and mouth orifices to inhale oxygen. And now, if oxygen sats are above 90%, nasal prongs are the preferred option. This can be administered at a slower rate of 2 to 4 litres as it only uses the nasal route for administration. The benefit with using nasal prongs is it still allows the mouth to be able to communicate, eat and drink. Other vital signs should also be closely monitored. Matt has a lower respiratory tract infection and the impact on his immune system can be measured with temperature. The blood pressure should also be monitored as many medications and treatments can alter this. Too high or too low blood pressure can cause a lot of strain on the body, especially the heart, impacting on the recovery process.
Assessment of patients is a major role in nursing care, and by expanding assessment techniques, nurses can ensure that patients receive the most appropriate and applicable care to meet their needs. From these assessments, the nurse can determine which interventions or treatments are necessary for the patient. Auscultation allows the nurse to assess a patient's cardiac, respiratory, and intestinal state. It should be carried out as a baseline for patients with a known lung disease or in acute respiratory distress. During auscultation, audible changes can be heard during respiration, which displays the respiratory competence of the patient as well as the patient's physiological state. More specifically, auscultation aims to listen for movements of air and fluid within the different organs and determines the various normal or abnormal breath sounds. Why do we auscultate for a patient with cystic fibrosis? This is because lung sounds provide useful information for assessing and monitoring patients with CF. We are able to hear abnormal sounds such as crackling, which is an indicator for mucus buildup in the lungs. Preparing to auscultate the lungs. Before conducting any form of physical assessment, it is important the nurse establishes an acceptable therapeutic relationship to ensure good patient-nurse interaction. Firstly, you should introduce yourself, gain consent, and give a rationale as to why you are conducting respiratory auscultation.
Implement optimal hand hygiene as well as decontaminating equipment and achieving a clean working environment.
It's important to make sure that both the nurse and the patient position themselves optimally and avoiding any awkward bending and twisting. It is recommended that patients should be placed in a comfortable position such as sitting upright and should given back support when needed. Lastly, it is important to emphasize privacy and dignity to the patient.
It is important to note that the diaphragm of the stethoscope should be used for high-pitched sound while the bell is used for low pitch. Demonstrate to the patient the required breathing exercises. Ask the patient to take a deep breath. When using the diaphragm, there should be a firm amount of pressure applied, whereas only a light pressure for when you use the bell. Proceed to auscultate the lung fields over the anterior chest from the apices in the supraclavicular areas down to the fifth rib. Progress from side to side as you move downwards. Listen to one full respiration at each of the locations.
Assisting the patients with ADLs or activities of daily living is important for a patient with cystic fibrosis. It has been studied that patients with CF had significantly lower respiratory and peripheral muscle strength when compared to their healthy peers. Overnight, the patient will accumulate an abundance of mucus in the respiratory tract.
During morning routine, It is important to not rush the patient to get ready. Make sure you give the patient time to cough up any mucus and allow them to slowly adjust to their day.
If a patient arises too quickly, they are likely to have difficulty breathing and will exhaust themselves. Getting a patient out of bed is important, as well as assisting them when walking and monitoring them in case the patient exhausts themselves.